My product is one called Compilldre, which is an app for managing prescription pills. I first got the idea for Compilldre when I was in contact with my grandparents over a WhatsApp video call. My grandmother handed the phone over to my grandfather, and I was met with the sight of his swollen face, which isn't uncommon. For all of my life, my grandfather has mixed up his prescriptions, and this, in tandem with his allergies, culminates in obscene swelling that makes him stay at home so nobody has to see him. For this reason, I believe there should be an app called Compilldre, which is a portmanteau of the Spanish word compadre, meaning buddy, and pill. I intend for the app to aid end users in distinguishing between their pills. Although there are apps that set pill reminders and apps that help distinguish between pills, I have yet to find a program that does all of this with the addition of a game. Users would input their prescriptions and pictures of individual pills, being able to play a matching game for the sake of memorization, thus preventing mishaps. My app boasts the presence of Unicode. The Unicode standard is the most widely used character encoding standard and is recognized by virtually every computer system. The first 128 characters are assigned the same sequence of bits as ASCII to maintain compatibility with older ASCII formatted information, but because Unicode is the universal standard, it encompasses more than 100,000 characters. Because Unicode uses a variable number of bits to represent each character, non-English characters and special characters like emojis can be represented. In relation to my app, the incorporation of Unicode would allow for compatibility with non-English speaking end users. The app also allows end users to grant access to their electronic health records, making it so that they can keep track of their prescriptions while differentiating from past prescriptions and looking at their electronic health system. In 2004, President Bush signed an executive order titled the President's Health Information Technology Plan, which established a 10-year plan to develop and implement the electronic health record systems across the United States to improve the efficiency and safety of care. An electronic health record is a digital version of a patient's paper chart. EHRs are real-time records that make information available instantly and securely to authorized users. While an EHR does contain the medical and treatment histories of patients, an EHR system is built to go beyond standard clinical data collected in a provider's office and can be inclusive of a broader view of patients' care. EHRs are a vital part of health IT and can contain a patient's medical history, diagnoses, medications, treatment plans, immunization dates, among other things. They also enable safer, more reliable prescribing and check for problems whenever a new medication is prescribed. By alerting the clinician to potential conflicts, end users notably benefit in differentiating between their prescriptions, which is a feature of the app. With the presence of Unicode as a universal standard allowing end users of many different backgrounds to use the app and compatibility with their EHRs, Compilldre is really your pill buddy. With its simple interface, it assists end users of all ages who need to keep up with their prescriptions.